Menopause is not a disease, but a natural transition in women that occurs at the age of 45 to 55 years, when the menstrual cycle stops and sex hormone levels decrease. Every woman faces varied physiological and psychological changes during this time. Sometimes such disturbances attain the stage of a disease or a syndrome called menopausal syndrome, which is accompanied by various vasomotor, psychological, genital, locomotor, and GIT related symptoms, and hence require management. Ayurveda identifies the stage of life in women as rajonivritti, meaning cessation of periods, and considers it as a natural process in the onset of old age. This phase of life in women is commonly associated with increased vata and decreased pitta and kapha, and a process called dhatukshaya, which means degeneration of all tissues. Owing to these changes, women undergo varying degrees of physical and mental changes in the body, such as weight gain owing to slowing metabolism, bone and joint problems, fatigue and exhaustion, low libido, altered energy levels, changes in skin and hair, lowered immunity, hot flashes, sleep disorders, mood swings, emotional and mental stress, and the list goes on. Literally, menopause affects every part of body and mind. Ayurvedic management of menopause can be based on three therapeutic modalities: internal administration of herbs, external treatments such as application of oil through massage or other panchakarma treatments like shirodhara, certain detox therapies, and the third one is controlling of mood and abnormal mental urges and feelings, as well as distraction of mind and emotional breakdowns. Every woman shows varying degrees of symptoms, both in number and intensity. So Ayurvedic management depends a lot on the individual requirement of that person. Today, we will talk on some Ayurvedic herbs that help in managing the symptoms of menopause. The first one is Aparajita. The botanical name is Clitoria ternatia. English name is butterfly pea. It is pungent, bitter, and astringent in taste, has a pungent after digestion taste, and is cold in potency. It balances all three doshas and has a special effect on mind and is considered as a brain tonic. It relieves burning sensation, improves digestion, is good for skin, and helps in managing urinary problems. Studies on the estrogenic effect of root extract of this plant concluded that this plant is useful in the treatment of postmenopausal symptoms. The second herb is Shatavari. The botanical name is Asparagus racemosus. The English name is wild asparagus or climbing asparagus. It is sweet and bitter in taste with sweet after digestion taste. It is cold in potency, is heavy and unctuous in nature. It mitigates vata and pitta. Shatavari is an adaptogen that can be used for female health at any point in life. Studies have found that women undergoing menopause complained of significantly lesser cognitive issues after administration of Shatavari due to its hormone balancing effects and phytoestrogenic properties. In Ayurvedic theory, menopause causes imbalance and aggravation of vata, leading to such symptoms as hot flushes. This herb has a downward cooling energy, thereby correcting this energetic imbalance. The third herb today is Kumari. The botanical name is Aloe barbadensis. The English name is aloe vera. It is bitter in taste, has pungent after digestion taste, and is cold in potency. It is heavy, unctuous, and slimy in nature and balances all three doshas. It is cooling in nature. It acts as an aphrodisiac, has anti-aging and tissue rejuvenation properties. It is a uterine tonic owing to its phytoestrogenic properties. It improves strength and immunity and corrects digestive problems, is good for hair and skin health, and a lot more. The fourth herb is Ashoka. The botanical name is Saraka Ashoka. English name is Ashoka tree. Ashoka means one that relieves pain and grief of women. It is an important Ayurvedic herb used in gynecological conditions. It is bitter and astringent in taste and has pungent after digestion taste. It is cold in potency. It is light and dry in nature. Again, it balances all three doshas, especially Kapha and Pitta. It has been shown to reduce inflammation throughout the body. It helps in correcting hormonal imbalance. It has systemic antioxidant activity and exhibits cardioprotective properties, as women with less estrogen are more prone to cardiovascular diseases. It supports multiple aspects of menopause. Ashoka has an ability to harmonize all three doshas in the female reproductive tract, giving balance to these tissues. It also has a gentle downward moving energy, and all these qualities are ideal for female healthcare. And the last herb that we are going to discuss today is Punarnava. The botanical name is Boravia diffusa. The English name is spreading hogweed. Punarnava means it makes the body new again. That's the literal meaning of Punarnava. So it has excellent anti-aging properties. It is sweet, bitter, and astringent in taste and has pungent after digestion taste. It is hot in potency and is light and dry in nature. It balances mainly Vata and Kapha dosha. It is very helpful in managing fluid retention in the body and balances Kapha dosha, thus helping in managing weight issues, etc. post-menopause. Punarnava helps in promoting liver and kidney health and thus helps in managing menopausal symptoms. Some classical Ayurvedic formulations recommended for menopausal symptoms include Shatavari Gulam, Sukumara Ghritam, Ashoka Rishtam, Kumarya Asavam, Punarnava Manduram, Ashwagandhadi Lehyam, etc. An Ayurvedic approach with herbs and a holistic treatment of mind and the body helps in easing the transition of this phase in life without making it feel like a crisis. These herbs are very safe to be taken if someone is having mood swings are very common in menopause. And the first herb, which I said, Aparajita, it's also called Shankapushpi. It is considered as a Medhya, means it helps in the treatment of mind and mind disorders, including anxiety, stress related to mind. And that Shankapushpi, if taken, even as a single herb, helps a lot. And it can be taken without any prescription or under the guidance of a physician. It can be taken very safely.